Welcome back to our channel. Today we're diving into an important health topic that could save your life or the life of someone you love. We're going to be talking about a condition that affects millions of people around the world and often goes unnoticed until it's too late. Chronic kidney disease, or CKD, is a serious condition that affects millions of people worldwide. The kidneys, those bean-shaped organs, play a vital role in filtering waste products from our blood. When they're not working properly, it can lead to a whole host of problems. The scariest part? Early CKD often has no symptoms, making it a silent threat. That's why we're here to empower you with knowledge. In this video, we'll break down 8 warning signs of CKD you absolutely shouldn't ignore. Remember, knowledge is power and early detection is key to managing CKD effectively. So let's get started. Let's talk about why early detection of chronic kidney disease is so important. Our kidneys are incredibly resilient organs. They work tirelessly, filtering our blood and removing waste products. But they don't complain much when something's wrong. In early stages, you might not notice any symptoms. That's why it's called a silent disease. Like a thief in the night, it chips away at your health. Imagine a car engine. A small malfunction can lead to major failure. The same goes for your kidneys. Catching CKD early is vital. Early detection can slow or halt CKD progression. It gives you a fighting chance to protect your health. Remember, your health is your most valuable asset. Let's talk about a symptom that's all too common but often brushed aside: fatigue. We all feel tired now and then, right? But when it comes to CKD, persistent fatigue can be a red flag. Healthy kidneys produce a hormone called erythropoietin, or EPO for short. EPO stimulates the production of red blood cells, which carry oxygen throughout your body. When your kidneys aren't functioning optimally, EPO production drops, leading to a decrease in red blood cells. This condition is called anemia. Think of it like this. Imagine your body is a bustling city, and red blood cells are the delivery trucks carrying oxygen to all the different neighborhoods. With fewer delivery trucks on the road due to anemia, those neighborhoods, your muscles, organs, and tissues, don't get the oxygen they need to function properly. And what happens when your body doesn't get enough oxygen? You guessed it. Fatigue sets in. You feel drained, lacking energy, and even simple tasks can feel exhausting. Now, fatigue on its own doesn't necessarily mean you have CKD. It could be a symptom of various other conditions. But if you're experiencing persistent, unexplained fatigue, especially alongside other symptoms we'll discuss, it's crucial to see your doctor to rule out any underlying issues. Now let's talk about something we all do. Pee. Changes in urination can be a major red flag for CKD. Kidneys remove waste from your blood and flush it out through urine. When kidneys struggle, you might notice changes in frequency, appearance, or sensation. One common change is increased frequency, especially at night. Another change is foamy urine. Protein can leak into your urine, creating foam. Blood in urine can range from pinkish to dark red. Always get blood in urine checked by a doctor. Pain or burning could indicate a UTI, linked to kidney problems. Chapter 4. Swelling. When your body holds on to excess fluid. Ever noticed your ankles, feet, or hands looking a little puffy? While occasional swelling can be normal, persistent swelling, especially in these areas, can be a sign of chronic kidney disease. Remember, your kidneys are responsible for filtering waste products and excess fluid from your body. When they're not functioning properly, that fluid can build up, leading to swelling, also known as edema. Think of it like a clogged drain. When the drain is clear, water flows through easily. But when it's clogged, water backs up and can overflow. Similarly, when your kidneys can't keep up with fluid removal, it accumulates in your tissues, causing swelling. You might notice that your shoes feel tighter than usual, your rings are harder to put on, or your ankles look puffy, even if you haven't been standing for long periods. Now, swelling can also be caused by other factors, such as standing for long periods, pregnancy, or certain medications. However, if you experience persistent or unexplained swelling, especially if accompanied by other symptoms we've discussed, it's essential to consult your doctor. Chapter 5. Shortness of breath. A sign of fluid overload. Let's talk about something crucial for life itself. Breathing. Feeling short of breath can be a scary experience, and it's definitely a sign that something's not right. When it comes to chronic kidney disease, shortness of breath can be a sign of fluid overload. Remember how we talked about the kidney's role in removing excess fluid? Well, when they're not working properly, that fluid can build up not only in your tissues, causing swelling, but also in your lungs. Imagine your lungs as delicate air sacs that need to expand and contract to take in oxygen and release carbon dioxide. When fluid accumulates around these sacs, it restricts their movement, making it harder to breathe. You might feel like you can't catch your breath even after minimal exertion. You might also experience shortness of breath when lying down, as gravity can cause fluid to pool in your lungs. Now, shortness of breath can have various causes, from asthma to heart conditions, but if you experience persistent or unexplained shortness of breath, especially alongside other symptoms we've discussed, it's crucial to see your doctor to determine the underlying cause. Let's be honest, we all scratch now and then. But when it comes to chronic kidney disease, persistent, unexplained itching can be a sign that something's amiss. Remember how we talked about your kidney's role in filtering waste products from your blood? Well, when they're not working properly, those waste products can build up in your bloodstream, leading to a whole host of problems, including itchy skin. Think of it like this. Imagine your bloodstream as a network of rivers and streams and waste products as debris floating in the water. When the kidneys are functioning correctly, they act like dams, filtering out the debris and keeping the water clean. But when the dams are damaged or not working properly, debris accumulates, polluting the water. In the case of chronic kidney disease, the buildup of waste products in your bloodstream can irritate your skin, leading to persistent itching. You might notice itching all over your body, or it might be concentrated in certain areas. The itching can be intense and relentless, disrupting your sleep and affecting your quality of life. Now, like other symptoms we've discussed, itching can have various causes, from allergies to dry skin, but if you experience persistent, unexplained itching, especially if accompanied by other symptoms we've discussed, it's essential to consult your doctor. Let's talk about a symptom that always warrants attention: chest pain. While chest pain is often associated with heart problems, it can also be a sign of chronic kidney disease, especially when it's related to fluid buildup around the heart. Remember how we talked about fluid overload? Well, when your kidneys aren't removing excess fluid effectively, it can accumulate not only in your tissues and lungs but also around your heart. This fluid buildup, known as pericarditis, puts pressure on your heart, making it harder for it to pump blood efficiently. This pressure can cause chest pain, which might feel like a sharp stabbing sensation or a dull ache. You might also experience chest pain when you breathe deeply or cough, as these actions can further increase pressure on your heart. Now, chest pain is always a serious symptom that should never be ignored. While it can be caused by various factors from heartburn to muscle strain, it's crucial to seek immediate medical attention if you experience any type of chest pain, especially if it's severe or accompanied by other symptoms like shortness of breath, sweating, or nausea. Let's talk about a condition that often goes unnoticed but can have serious consequences: high blood pressure, also known as hypertension. High blood pressure is often called a silent killer because it often has no symptoms but can significantly increase your risk of heart disease, stroke, and kidney disease. Now, here's where things get interesting. High blood pressure is both a cause and a symptom of chronic kidney disease. It's a bit of a chicken and egg situation. High blood pressure can damage the tiny blood vessels in your kidneys, making it harder for them to filter waste products effectively. Over time, this damage can lead to chronic kidney disease. On the flip side, chronic kidney disease can also cause high blood pressure. When your kidneys aren't functioning properly, they can't regulate blood pressure as effectively, leading to hypertension. It's a vicious cycle. That's why it's crucial to monitor your blood pressure regularly. You can do this at home with a blood pressure monitor or by visiting your doctor or a local pharmacy. If you have high blood pressure, it's essential to work with your doctor to manage it effectively through lifestyle changes, medication, or a combination of both. So there you have it. Those are 8 warning signs of chronic kidney disease you should never ignore. Remember, early detection is key. If you or someone you know is experiencing any of these symptoms, it's crucial to consult a healthcare professional as soon as possible. Don't let fear hold you back. Knowledge is power. Getting the right medical advice can make all the difference. Your kidneys work hard for you, so let's show them some love by being proactive about our health. Don't forget to like, share, and subscribe for more health tips and information. Stay healthy and take care.